Can you see this?
Yes.
So, medical emergencies in dental practice. Okay. So we'll just see how to manage or what should be there for our first aid management. Step 1 is information and risk assessment. Medical history and drug information should be there with you. Planning and preparation, equipment, drug tray and training. So if you are seeing that the patient, see nowadays all alternative patient, they are of any medical sort of, they need any medical assistance. Okay, so you should keep your emergency drugs always ready. Okay, and then critical incident analysis should be there. So the preparation, all dental personnel must be trained in techniques of IM, intramuscular injections and IV injections. Okay, we are expecting endotracheal intubation and basic CPR. So basic CPR should be there. I know endotracheal intubation is a very challenging thing and it cannot be done with we are trained in endotracheal intubation, but we can't expect all the dental trainees to be doing this, because it is all sometimes very challenging for the anesthetist to do this. Okay. So common medical emergencies are cardiovascular emergencies are angina, MI, arrhythmias, cardiac arrest, and cardiogenic shock. Then in respiratory system, acute exacerbation of bronchial asthma, okay, chronic pulmonary obstructive disease, then foreign body inhalation. In central nervous system, syncope, most commonly seen, epilepsy, cerebrovascular accident, then hypoglycemia and anaphylaxis. Correct? So emergency drugs, what you should have: injectable drugs, adrenaline, okay, it is a life-saving drug, adrenaline, antihistaminics, okay, then anticonvulsants such as diazepam, analgesics, vasopressor, and corticosteroid. Okay, this corticosteroid you must have in your clinic. Okay, either in the form of dexamethasone or in any form, you must have in your clinic. Then sodium bicarbonate, xylocard, atropine, dextrose, immunophilin. In non-injectable drugs, oxygen, nitroglycerin for angina. When the angina patient is, then 0.3 milligram of nitroglycerin is kept sublingually. It is absorbed first and angina can be relieved unless and until the medical help is there. And nifedipine, liquor ammonia as a respiratory stimulant, oral glucose for treating hypoglycemia, and salbutamol for asthma patients. Mostly asthma patients, they carry their inhaler. So when the patient is giving you history of asthma, you ask patient, okay, you brought your inhaler? He will say yes. Take that inhaler and keep in front of your eyes. Okay. Emergency equipment, oxygen delivery system, suction and suction tapes, syringes for injectables, artificial airways, scalpel for tracheostomy, and endotracheal tubes. See, whenever you see the patient, whenever you see a patient which is who is having the all these symptoms and all, and or the patient is giving a medical history like this, you always, it's better to refer the patient. Always is better to refer the patient to a higher center, where a big hospital, where the cardiac backup is there and everything is there, and they have a dental setup also. And you can write high risk patient can be taken under general anesthesia or local anesthesia in a higher center, and explain the patient nicely. See, we are not having a medical backup, and you are having this medical problem. In case this happens, so I would want, or our team would want, that you should be in a higher center. There are 5% chances that this will happen. 95% there is no chance. Okay, but 5% chance, we don't want to take chance for you. okay, on you. So this is for your benefit that you should go and get treated there. So the patient will appreciate this. Okay, patient will appreciate this sometimes. See, this is not anything that you are incapability. But yes, backup of the center, we don't have any cardiac backups in our dental centers. Okay, so it's better to refer these type of patient in a higher center. But for referring also, you have to identify the cause. Without identify the cause, you can't refer a patient also. Okay. These are for emergency. In case before referring something happens, okay, so you can manage. At least manage till the help is there, medical help is there. It includes an assessment of airway extent, neck and clear the airway, then breathing, mouth-to-mouth breathing. 100% of oxygen can be delivered through a mask or ambu bag. So ambu bag or mask should be there. Mask, at least mask should be there so that you can give an artificial breathing. Then for circulation, cardiac massage is done at the rate of 60 per minute. In cardiac arrhythmias, there is history of palpitation and the pulse rate of the heartbeat are irregular. Indefinite diagnosis can be made only. ECG must differentiate between tachycardia and bradycardia. So this is the most designable ECG you can see in supraventricular tachycardias. Okay. There is a book called ECG Made Easy. Very small book, very thin book. Okay. In your free time, you can go through those books. They are very interesting. On one page only, some findings, clinical findings, and ECG of the particular disease is given. So you may come across those pages. Sometimes when you see a ECG, you can recognize, okay, I have seen this type of ECG. Then you can open your book and tell you, okay, this is it. See, very interesting. Over the period of time, you can just tell the disease by looking into the ECG. Okay, this is so everybody will say, okay, she has become from dental surgeon to dental surgeon, and now she's become a cardiologist also. Then there is arterial flutter. Okay, so these are the patterns of ECG and arterial flutter. So in arterial flutter, what should be given? Digoxin or digitalis. Okay, heard in pharmacology in second year. Digitalis and digoxin. Long question. Again, arterial fibrillation, ventricular ectopics, tachycardia. So in these type of cases, it is not expected that you are giving the whole of the treatment. You should know the treatment, but you are not expected to give all the treatment. You have to manage the patient from. You have just to give first aid. You have to manage the patient till the medical help arrives. Okay. We must stop dental procedure immediately. Don't try to keep extracting a root piece, or you don't try to. Okay, I'll just 2 minutes. I'll complete my RCT. No. Okay, or check the vital signs, pulse, BP, respiration. Start oxygen ASAP. Start oxygen if you have. Then give sublingual isosorbide nitrate and aspirin oral immediately. Refer to a cardiologist for further management. In myocardial expansion, sometimes chest pain is very severe and it lasts more than 20 minutes, does not respond to any rest or nitrate. Okay. On examination, there is pansystolic murmur. It's very difficult to identify murmurs now for me. Okay. At one time when I was posted in general medicine, I was used to differentiate the murmur of pansystolic murmur and this other murmurs, but nowadays, so you can just diagnose the patient by virtue of history. Okay, by virtue of history. This is the ECG in MI. So And if the patient is having myocardial infarction on dental chair, what should be the management? This is very important. The cardiac enzymes will be elevated, SGOT and LDH. Stop the dental procedure. The dental chair is adjusted so that the patient assumes the supine position. Same your syncope position. Check for the vital signs. Start oxygen. Give injection morphine 15 mg IV. Give tablet isosorbide D-nitrate 5 mg sublingually. Give tablet aspirin 300 mg. Advise complete bed rest and shift the patient to the ICU. Correct? So this is the main. Any potent painkiller can replace me. Morphine is not easily available. Okay. So any potent painkiller, isosorbide, aspirin. These three things should be there along with the major fact, oxygen. Oxygen is mandatory. In asthma patient, we have inhalation of salbutamol or terbutaline. Okay. Then steroid should be there in the your operator. Okay. Even after third molar surgery and all, 0.5 ml or 1 ml this steroid, it should be given at the operatory site. This will what will happen in this? The wound will heal unevenly and very less swelling is there. Okay, and this small dose will not hamper anything in generally. Okay, so what I used to give this small dose of dexamethasone. Okay, the patient is comfortable after the surgery also. If attack is severe, subcutaneous adrenaline 0.5 ml 1:1000 solution can be used. Injection hydrocortisone, again steroid, okay, can be used IV. Meanwhile, all can call ambulance and shift the patient to the hospital. In epilepsy, just make the patient comfortable and injection diazepam. If the patient is not giving any oral, not taking anything orally, then the injection diazepam slowly can be given. So, have you seen any medical emergencies in clinic?
No.
Syncope, it can be syncope. You must have seen.
Not my patient, but yes.
Okay. So it can be in my patients. All the patients are before that. All the patients, they are frightened. Okay, what will happen next? All surgery patients, they have like, mostly males. They just what happened? They just don't shout. So when a child shouts, when a female cry or anything, the enzymes, they are released. Okay, but in males, they feel like I will shout, the assistant will laugh over me, so they don't shout and they just go into syncope. And sometimes after the procedure is complete, they go into syncope. Okay, so if it occurs, the patient has pre-syncopial symptoms like sense of warmth, lightheadedness, feel sick and sweaty. Okay, the pulse is feeble and the skin feels cold and moist. Following this, there is loss of consciousness. The patient will rapidly recover consciousness if placed in supine position. The patient must be made to lie down into supine position and the legs must be elevated. The patient clothes must be loosened. Proper ventilation is assured. Vital sign must be checked to rule out the cardiac arrest. Okay. In stroke, the patient's vital signs, they are checked. The patient is made to lie in the lateral position and physician is called. In hypoglycemia, the patient is said to be hypoglycemic when the plasma glucose level is less than 60 mg percentage. It is common in diabetics who miss a meal or take overdose of hypoglycemic agent or insulin. It must be anticipated that in all the diabetic patients. So when the diabetic patient is on insulin, their glucose level is low. So you have to be kept handy with the glucose. Sometimes they go into hypoglycemia. Okay. A hypoglycemic patient often feel very extensively hungry, develops a moist skin, bounding pulse, and become irritable and aggressive. Later, the patient may lapse into an unconscious state also. If detected early, hypoglycemia can be treated by oral glucose. If it is more severe, then can be treated IV administration of 50 ml of dextrose immediately. Alternatively, one may use glucagon 1 mg, and then response to the team treatment is often dramatic. In anaphylaxis, anaphylaxis is allergic reaction. It is very severe, immediately hypersensitivity reactions such drugs like penicillin, xylocaine, NSAIDs, radiopaque, dyes, etc. In xylocaine, methylparaben is mostly the causative agent, which is the preservative used in the lignocaine or xylocaine. Okay, in our local anesthesia, it is present. Some rashes are there, urticarial rashes are there, severe itching is there, difficulty in breathing due to laryngospasm, and then bronchospasm, giddiness, hypotension, and shock stage in anaphylaxis. Okay, step by step. So the drug of choice is adrenaline, 0.5 ml. Okay, 1:1000 is given subcutaneously. Adrenaline is given subcutaneously. Okay, other drugs which can be used are hydrocortisone, then amylophyllin, and some patients have severe laryngospasm. They may need endotracheal intubation. Okay, so these are the most common medical emergencies in the dental practice. So next class is on Friday.
Okay.
So we'll continue next class on Friday. Have you started your project?
I have saved quite a few OPGs.
Okay, so just go through one OPG. Okay, trace on one OPG and jot down the findings and then share it with me on one. I'll tell you how to go about it. If it is correct, I'll then go a tick for you. Then you can go ahead with all your cases very fast. Okay.
Okay.
Yeah.
Okay.
Yeah.
Okay. Thank you.
Yeah. Take care. Bye bye.
Bye bye. Thank you.